Welcome to day 3 of our virtual open house. So today's educational topic is going to be on 2 of the procedures that we offer here. One is going to be Silhouette InstaLift, and then the other one is going to be Sculptra Aesthetic. So for those of you who don't know me or haven't met me before, I'm the PA here. I own Renew Medical Spa, and I'm kind of the main injector here. We have Taylor now here as well. She's awesome. But I do all of the Silhouette InstaLift and the Sculptra procedures. So I also have a special guest here with me today that I'll be introducing to you in just a little bit. Diane is a patient of mine who has graciously agreed to come in today and share her journey with you through her Silhouette InstaLift. So she'll kind of give you a little inside scoop on some of her experiences with Silhouette. So the reason I kind of chose these 2 procedures together, I think that they tie together very beautifully just because they are both made up of the same material. So both InstaLift and Sculptra are both made of PLLA, which I'll go into some of that detail. One just happens to be in a suture form, one is in an injectable form. So I'm gonna just kind of go into a little bit more here about what InstaLift is. And just a little background here for you as well. So I've been performing, aesthetic and cosmetic treatments for about the past 16 years. So, on a daily basis, performing Botox and fillers. These are phenomenal tools that we have, when it comes to facial rejuvenation. But when the Silhouette InstaLift came on the market here about 5 years ago, it really has been a game changer for me in my practice because it's really the only tool that I have that I can physically lift and retract tissue. It's not a full facelift, but it is still considered non-surgical. So let's kind of go into a little bit more about InstaLift. So again, InstaLift is an FDA approved treatment that allows us to use what we call micro suspension technology. So it's an absorbable suture, and I'm going to show you exactly what that little suture looks like. It basically gets placed directly underneath the skin, and it helps to lift. So I don't know if you guys can see this. I'll kind of try to hold it up against a dark background, but it physically is just kind of like a suture, an absorbable suture that goes underneath the skin. And what it does is it helps to lift and retract the skin. So it helps to give some volume in the cheek, pulls the fold back, kind of lifts the corner of the mouth, and then also helps to kind of sharpen the jawline. So typically what will happen, during a consultation, when a patient and I are talking, this is most commonly what they'll say is, I wish I could just have just a little bit of a lift. And you could even see it on me. I think I would be a great candidate actually for InstaLift. As we start aging, all of this skin here starts moving forward. And people will usually come in and say, I don't like this. But what I'm seeing, and when I'm looking at you, I'm literally envisioning what's happening underneath your skin. I'm envisioning the whole aging process, how these fat pads have started to thin over the years, and that's why some of that skin is then draping forward. We've lost collagen, we've lost volume, we've lost fat in our face. And so when I start seeing people give this little bit of a lifting effect, I instantly think about InstaLift. So the name kind of tells it all. It's like an instant lift. The other kind of unique thing about this particular procedure is that this suture is absorbable. Like I said, it's made up of something called PLLA, poly-L-lactic acid. They're sort of like these little sugar molecules. Once they go underneath the skin, they will very slowly begin to dissolve over time. And what happens is they start to stimulate your own natural collagen. So this procedure is very appealing to people who, again, kind of want this nice little bit of lift, but may not be really necessarily wanting to move into doing dermal fillers, kind of having, maybe a puffy looking cheek, things like that. So it is very natural, and it really is just lifting your own natural tissue and putting it back into a position where it used to be, I always tell people, about 5, maybe to 7 years ago. So we're kind of turning back the hands of time. So you might be asking, I wonder if I'm a candidate for InstaLift. Well, the best way to find out, obviously, is to come in and do a consultation with me. But as long as you're relatively healthy, no major underlying medical conditions, no autoimmune disorders, you're really going to be a candidate. So far, I've performed the procedure on patients anywhere in their 40s through 70s. My oldest patient was 80. She wanted to do it for her 80th birthday present for herself. It was kind of fun. But, you know, I always tell people, if you're truly a facelift candidate where there's just a lot of excessive tissue, this does have limitations. This isn't a surgical facelift. This is a mini skin facelift, okay? It's still, you know, a little bit of a minor surgical procedure, but certainly is not going to give a facelift-like effect. So when people come in and they're really pulling and there's a lot of excess skin here, you know, I have to kind of set clear expectations that this really is just giving a nice little bit of lift and a tightening effect. You know, generally what I will tell people too is that usually this kind of takes place of doing fillers. So we don't have to, you know, place fillers in the cheek. We don't have to place fillers in these folds. But if we do have some deeper, you know, kind of more etched lines and wrinkles around the mouth, or somebody is desiring a little volume in their lips, then yes, we still have to use a little sprinkle of filler in those areas just to kind of fine tune that. So exactly how does InstaLift work? Well, when you come to my office and we've decided that you are an ideal candidate for InstaLift, the procedure is done right here in my office, just under local anesthetic. So what that means is just with a little bit of lidocaine. So again, if you're kind of envisioning this suture going underneath the skin, we have to get it underneath the skin. So there'll be some local anesthetic or numbing placed in several areas along the face to keep you comfortable. And then we do this under a sterile technique. So even though we aren't in the operating room, just with my surgical background, I really like things to be as sterile as possible. It really just needs to be a clean procedure for those of you that are that work in the OR and things like that. So just definitely want to keep things sterile as possible, minimizing any risk for infection. But once the sutures are placed underneath the skin, and we kind of set everything in place, you're literally going to have an instant lift. So InstaLift, you're gonna see the immediate results. How long does it last? Most people are gonna get about 18 to 24 months, again, depending on how many sutures we're using, how much skin we have to lift, and kind of what your activity levels are. So on average, I'll use 3 to 5 sutures per side. So in summary, basically what InstaLift is, it's a lift without surgery. It's volume without fillers by placing these absorbable threads underneath the skin with local anesthetic here in the office. You're able to drive yourself home afterward. I always tell people the big thing with this in comparison to doing a filler is you really do need about a week of very limited activity. I don't want you working out, doing any heavy lifting. You know, you just need to, if you're working from home and just kind of hanging out behind your computer, that's really an ideal time to do this. So we'll be posting some before and after photos for you to take a look at. So if you want to, we'll have Diane's before and afters here as well. But I am going to turn it over to Diane, and we're just going to talk to her a little bit more about her experience with InstaLift. And just so you know, she's actually had InstaLift twice now. We have done hers twice because we added a couple of threads the second time round. So I'm going to just kind of turn the camera over to Diane, and then we'll let her answer a few questions here. Make sure that I don't. There's Diane.
Hello.
Hi, Diane. So I think a lot of people, you know, when I have a consultation, people kind of come in with, you know, a number of different questions. But I was kind of wondering, Diane, if you would kind of answer what appealed to you about having InstaLift?
Well, the lifting part, especially like right around the jaw lines, and it actually kind of lifts your neck a little bit because it's pulling all of this. Mm-hmm. And it really is pretty amazing. I mean, for the little bit of downtime, I'd say like 2 days. I mean, if you ice it right away, you listen to what Jessie says how to take care of it, you're really not going to have a lot of bruising. So I don't get a lot of bruising, but I ice it and I listen to everything she says. except for the alcohol part, just kidding.
She's a very compliant patient. So, so I know, Diane, you and I also had talked about the fact that, ideally, you would be a surgical candidate just because of the amount of tissue that we were trying to lift.
Right.
But that was something that you just weren't really specifically interested in.
No, I'm not going to go under the knife, put it that way. So this is like way easier, and the downtime is way less.
So it's a great, a great option for people that really are not looking to take that step of something surgical. They really just want this nice little bit of a lift without a lot of downtime and or general anesthesia. So people are wondering probably, does this hurt?
No, the only part that's a little uncomfortable is when she puts the lidocaine. Is it lidocaine?
Lidocaine.
Lidocaine. And then after that, you don't feel anything. And then a little soreness probably the day 2. But it's not real bad. I mean, if you rest and ice it, it's...
And generally, you don't need to take anything for
No,
pain.
I don't take anything,
Yeah.
but because it isn't really it isn't painful at all.
Yeah, I would say at a maximum, people might take an ibuprofen or a Tylenol and some ice. That would be at the maximum. So, talk to people about what you looked like right away after the treatment.
You mean as far as bruising?
Nope,
or...
just like, how you had like some of the little pucker, like the little
Oh,
dimpling
you have like
of
a
the
little
skin.
bit of puckering on, but that goes away within 24 hours. So you'll have a little bit of lumps in your face. Just leave them alone, keep icing them, and they go away like in 24 hours.
So
For me, it did.
primarily just where sort of those
Where the
sutures came in
sutures
and
are.
out. There were just like a little bit of a...
And there wasn't any bruise. I mean, I don't bruise real easy. So I didn't have a lot of bruising, a little bit of black and blue, but that goes away in a couple days.
Yep, which is something, that's typical even just with a filler treatment. So some bruising, some swelling should be expected. So in terms of downtime, typically we tell people about a week of, not just laying around, but really just not any extreme heavy lifting and things like that. Did you find that was difficult for you to have that week?
It is, because I do work out, but for a week down, you can go for walks and things and just get more physical after the first week. So let your face rest.
Yep. Just let everything heal, let those sutures kind of set into place.
Correct.
Very good. And then you kind of addressed bruising. So I think that's the other thing people want to know is, am I going to bruise? Again, that's variable from person to person. We're definitely going to make sure that we take all the measures to minimize the risk of bruising, just like we would do with any surgical procedure or filler procedure, which would be avoid your ibuprofen, aspirin, Aleve, fish oil, a lot of the herbal medications like ginkgo, ginseng, those types of things. So if you avoid those things, we should really be able to minimize bruising. So how many days, tell everybody about how many days you're out right now from the last InstaLift.
It's been about a week and a half, so you can see it's already lifted. Everything's lifted. I don't know if you have the before and after pictures, but it's truly amazing what it does. And it's about an hour's worth of work Jessie does on your face, and then you have to do the rest, take care of it. So yeah, I would definitely do it again rather than going to surgery, because that's a long downtime.
Yeah. And the other thing too, to kind of point out is that you've done a lot of really nice and hard work on maintaining this, the beauty of your skin too.
Oh yes.
You've done a lot of the BBLs, you're using a lot of great skincare, retinol, sunscreen. So you really have taken good care of the surface of your skin.
The vitamin C and yes, skin sunscreen especially.
Yep. So she's also working with the estheticians on, good skincare regimen and other procedures that we do here. So wonderful. Well, thank you so much for taking the time to come in today and just kind of share, your journey with everyone. I think it's just, really important for people to hear from a real person that's had real results. And, it's not just me telling everybody that, things are going to be really, really cool.
It's definitely something I would recommend because there is not a lot of downtime and you look really good when you're done.
Well, and there's not a lot of other procedures that we really do in this industry that are able to actually provide that lift without actually having something surgical in nature. So,
Right.
You know, and during people's consultations too, I'll usually say, hey, I really think you need to, you know, take into consideration if you're thinking about having a facelift, then, you know, go do a consultation with the plastic surgeon. But if that's not an option for you, then InstaLift tends to be a really nice option. So
It is.
wonderful. Well, thank you so much for
Thank
coming
you,
in,
Jess.
Diane. And then I'm going to turn the camera back over towards me. So hello, everybody again. So we just kind of finished up talking about the Silhouette InstaLift and why that is such an awesome procedure. So if you guys still have further questions, you know, about InstaLift, the best thing to do would be just to give a call. I'm happy to do more of a one-on-one consultation with you, and we can really kind of talk specifically more about whether InstaLift is ideal for you. So, you know, just as an example, I mean, I really think I would be a great candidate. I've done Sculptra aesthetic as well, so that's going to be our next topic. So let's kind of dive into what Sculptra is. So Sculptra is actually kind of a really unique filler, if you will. It's really in a class all of its own. So traditionally, we think a lot about the hyaluronic acid fillers. So like the Juvederm Voluma, the Restylane Kiss, the Juvederm Volbella for around the lips. We have this whole line of all of these great hyaluronic acid fillers. HA fillers provide immediate results, immediate lift. With Sculptra, this is something that actually works with your skin over the course of time. So really it's stimulating your own collagen. So if you're looking for an instant result, Sculptra really isn't what we're talking about, but it really helps to rebuild the foundation of your skin. So as we age, and unfortunately we start losing collagen even in our early 30s, and then it just kind of continues from there. So that's a little bit depressing to hear, but the good thing is we have all of these really great tools to help rebuild back up our collagen and keep that volume in place. So more and more people are moving towards preventative. So starting in their early 30s, that sounds kind of crazy, but that is really just the reality of what's happening in this industry. So, you know, Sculptra is definitely something people in their 30s, 40s, and 50s will start doing. If we start just kind of losing a little bit of collagen, we're noticing a little bit of volume depletion. And you don't want to do anything that gives that sort of instantaneous lift. Maybe you just kind of want to keep things really on the down low. You're like, I don't really want people to know that I've done anything. I think Sculptra is a really nice option for people, because as we do a series of Sculptra over time, suddenly your skin just really starts glowing. It looks radiant. It just starts getting a little bit tighter. The skin itself will start to become a little bit thicker. And it happens to be one of Hollywood's sort of best kept secrets. So there's a lot of people that will say, well, I haven't had any work done. Well, this is a classic example of not having any work done, because really Sculptra is PLLA. There's these little tiny poly-L-lactic acid beads that we put into the skin. And then these little beads do all the work. Your body works with it to kind of re-stimulate your own natural collagen. So we call this a biostimulatory filler. So bio means self-stimulatory, stimulates collagen. So really it's you. We're not putting a filler into you. It's just we're giving your body the tools to help regenerate its own self. So that's really what's pretty unique about the Sculptra aesthetic. Typically people are using Sculptra in combination with other collagen stimulating treatments like a BBL, for example, broadband light. So that helps to rejuvenate the skin. It reduces brown spots, you know, some of the little age or sunspots that we get that kind of pop up over time after lots of sun exposure. So maybe you're wondering, I wonder if I'm a good candidate for Sculptra. Basically, everybody's a good candidate for Sculptra, 30 and above. I really think the sweet spot for Sculptra is going to be people in their mid to late 30s up into the late 60s. So especially when people come in and their skin itself has really started to thin and we're starting to look a little kind of gaunt. Some people actually even look a little bit skeletonized. You know, right around, if you look at your temple area, there's actually a fat pad up here that actually starts to thin out, and we can get a really hollow look to the temples. Sculptra does a really beautiful job at filling in the temporal hollows. And then again, it really just helps to kind of rebuild and thicken your dermis. So we have to start by rebuilding the foundation. So what to expect? So when you come to the office, Sculptra is one of these fillers that we have to pre-mix ahead of time. So there's a little bit of work preparing the solution, but when you come in, we'll always ensure that you're very comfortable during your treatment. We always use some local anesthetic, again, a little bit of lidocaine. And then after the treatment, so depending on which areas we're treating, so again, just think of it as like a little bit of an injection underneath the skin. It can be done here, it can be done in the temples, along the cheek area. And then after you leave, you know, typically you might be a little bit tender, swollen, very typical for, you know, all of the treatments that we really do here. But there will be a little bit of homework for you to do. So it's this particular treatment, you have to go home and you need to massage. You have to do kind of a 5 times a day for 5 minutes for about 5 days. And the reason we do that is because it helps all of these little particles that are underneath the skin. It prevents them from kind of clumping together. So we just don't want like little lumps or bumps to occur underneath the skin. I don't really see that happen very often, but as long as we're, you know, being really good about those post-care, you know, that massaging, you'll do just fine with that. So, so again, the Sculptra is kind of more an injectable form of the PLLA. The InstaLift is more the suture form of the PLLA. So they both have the exact same properties. So InstaLift kind of provides the lift. The Sculptra is rebuilding the foundation of our skin. It's re-thickening our dermis, and it does some general re-volumization. We can get a lot more done with Sculptra as compared to when we're doing sort of individual syringes of filler. So if we want to give somebody a nice pop in the cheek, yes, we still might use a Voluma, but if you're really thin and hollowed, you know, kind of down in what we call this submalar region, Sculptra is hands down probably the best job for that area. So again, I mean, if you still have questions about any of these treatments, come in, talk to me about it. We'll go into detail about whether, you know, these are great treatment options for you. Everybody's probably wondering about pricing and things like that. So with the InstaLift, it really just depends again on how many sutures that we use. But as a minimum, I always start with 3 per side. That starts right around that 2,200 range. And we can do up to 5 sutures per side as well. Sometimes we have to add one, you know, over time. Sculptra runs $799 per vial. That treatment I do in a series. So usually I'll do 1 to 2 vials per treatment, and usually we'll go through about a series of 3. About every 6 weeks or so we'll do that. So with the special that we have going on this week with Sculptra, it's buy 3 vials of Sculptra, get 1 free. Plus you also get a syringe of the Restylane, so which is the HA product. So if if you're thinking about doing your lips or even have some other little, you know, fine lines, we can kind of give you some instant results with the Restylane, while the Sculptra is kind of doing its work in the background, kind of stimulating your own natural collagen. So, kind of at the completion of a series of Sculptra, I would say you're going to gradually see improvements, the skin looking healthier, looking just radiant and glowing. You always see that right away after the first treatment, maybe 2 to 3 weeks later, but then you'll kind of see that volume replenishment occurring roughly between kind of 4 to maybe 5 or 6 months afterwards. It really just depends on your own body's ability to stimulate that collagen. Some people will see it a little bit sooner, some people will see it a little bit later. So make sure that you're dropping your questions, your comments. We'll try to get to those, you know, here throughout the day. You have all day long to rewatch the video. If you're watching today, you'll be entered in for our daily drawing, and then at the end of the week, depending on your purchase amounts, you may be eligible to be one of our grand prize winners. So thanks so much for tuning in today. I appreciate it, and let us know if you have any questions or concerns. Have a great day. Thank you.